morning, everybody. First Aid Friday. What are we looking at today? We're looking at burns. Why? Because on the 25th of this month, it is Burns Day, I think the word is, correct terminology. So I've just tied it in with that. You're probably thinking, why on earth has she got Worcestershire sauce here? Little story. I burnt myself once when I was a child, and there was this beautiful motorbike and it had lots of chrome on it. And I said to my dad, I said, can I go and have a look? He said, yeah, of course you can. He said, go and stand next to it. And he said, I'll take a photograph. So I did. I stood next to it and my leg went up against the exhaust of the bike, and by crikey, I burnt myself. I screamed and I cried. This lady came running out of her house. You saw what happened. And she came running out with this Worcestershire sauce. And she started putting it all over my leg. She said, this'll work. I thought she was going to eat me. Anyway, this does not work. Old wives' tale. Don't put butter on a burn either. There's 6 different types of burns. We treat all burns exactly the same though. That's the good news, apart from a chemical burn. I will do a separate video on chemical burns later. But regardless of the type of burn, it could be a scald, which is hot water, hot liquid, steam. Why is it? Or is it just me? You know, when you sort of like cooking, you take the lid off the pan and you go like that to have a look. Don't know. Maybe it is me. You've got scalds, you've got dry burns. So a dry burn is a bit like friction off a carpet or touching an iron. You have a cold burn. I'm sure you know what I'm going to say. Lamppost, cold, weather, frosty, Scotland, tongue. Go on. I'm sure you know somebody's put the tongue on a cold ice onto a light. What do you call those things? Street light at some point. I haven't. We've got electrical burns. Electrical burns, it might not look really bad, but trust me, please, 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 if you've ever burnt yourself with electricity, you must go and seek further medical attention. It might not look bad, but electricity's gone in, it's going to come out somewhere, and electricity's gone around your body, and it may have caused further harm. So make sure you get checked out. Radiation in Scotland, it's not that common, but radiation, an example is the sun. So yeah, I mean, joking aside, it is something I'm sure we've all had sunburn at some point, but that's what radiation is. Okay, so we've got the cold burn, we've got the chemical burn, we've got the scald, we have got the dry burn, we've got the electrical burn, and what's the other one? I can't think. Do you know what it is? Message below, okay? Right, so let's have a look then. Let's say I have burnt my leg. The first thing we want to do is get the person, whichever part of the body they've burnt, under cool running water as quickly as possible. Now, in Scotland, if you put on your tap, nearly ice cubes are going to come out of it in winter time. So just take it off that Scottish freezing ice cube setting so it's cool water. Now, the guidelines have actually changed about a year ago. We used to say 10 minutes. It's now changed to 20 minutes. Why? Because research shows that this is the most effective way of one, treating the burn, stopping it from getting any worse, and importantly, hopefully prevent any scarring. So a shower head is great. If you don't have a shower head when you're at work, then you're going to have to get a basin of water and just scoop the water and pour it, scoop it and pour it, scoop it and pour it, and just keep doing it to get the heat out. So let's pretend shower head is my leg. You only want to cool the area that is actually burnt. You don't want to submerge the whole person in, because that can have other negative consequences. So just the area for 20 minutes. Now, we've got different layers of the skin, and we want to make sure that we target all of those layers, yeah? We want to get the heat out of all of those layers. So I know sometimes after about 2 minutes, say, oh God, I can't be bothered, that'll do. It won't. It will start to reheat again, and it will continue to burn. So 20 minutes, right? Shh, time lapse. 20 minutes is done. I want to cover it, but what are we going to cover it with? Are we going to cover it with a bandage? No, because a bandage is fibrous, and if you put anything fibrous directly onto a bone, I can tell you, by crikey, it is going to hurt. When that bandage comes off, you're going to rip off all the good skin as well as all the old stuff, and you've now created a wound. So bandage in, bin. Right, so what are we going to put on? Cling film is great. It's a staple household item most of the time, but the problem with cling film is it's not going to fit inside a first aid kit. I'm going to show you something else as well. But if you are going to use cling film from your home, we advise you to take a couple of rounds off first for contamination. Maybe you were wrapping up chicken last time and could be left chicken stuff on it. Anyway, so cling film is great because it sticks to itself, not to the skin. So covering it loosely, you don't want to do it tight, because if you do it tight, you're going to stop the blood circulation. Then you've got another problem. The problem with cling film is trying to keep that cling film on when you're trying to move people. And also, that won't fit inside your first aid kit. So what will is this, a sandwich bag, a freezer bag. Straight off the roll, of course, not a used one, straight off the roll. And this is really good because you can put it on and then tape it on. The reason why we want to cover it with the plastic is it stops air, dirty air, getting into that burn, and so it keeps it clean. Okay, that's why we want to do it. If it is a large area, then you still want to cover it. Bin liner. You're probably thinking, really? Yes. So if it was, let's say, all my leg, I'm going to put my leg into the bin liner. Okay, it doesn't look great, but I don't care what I look like. What I do care about is making sure that I keep my injury as clean as possible so that it heals better. Sellotape, yeah, sellotape it on, you're good to go. Now, what further medical attention do you need to get for a person? Again, there's quite a lot of information there. What I will do is that if you wish to receive the guidelines for burns of when to get further help, what type of help to get, leave a comment below and I will send you the fact sheet. But this is good. This is the best way. Keep it clean. Seek further medical attention if required. Good luck with your cooking, your haggis this weekend if you're having it. Not sure yet. Anyway, I'm Sarah and I'm owner-trainer of First Aid at Work, Aberdeen and Aberdeenshire in partnership with Mini First Aid. If you need any training, please get in touch. Have a fantastic weekend, everybody, and keep safe. Bye-bye.